and we're going to get your info, okay?
Awesome. Thank you so much.
Thank you.
Congratulations
And
happy
Thanksgiving. Okay, Doria, hold on the line. We'll get your info in just a bit, all right?
And that was part of the Calvo's Count on Us for Life giveaway. Make sure to stay tuned because we are giving away 3 more prizes during our show. But in the interim, we're going to head on over to Saipan. Lots and lots and lots of interesting news going on over there in the CNMI. Tomas, good morning. How you doing?
Good morning, Tyler, Bree, Jason, and Mike. Yesterday, that alarming news of the 98 new positives. We were expecting to get some more data last night and early this morning. Last we checked, it hasn't come through. We're hearing that the focus is remaining on the contact tracing. I just wanted to put the numbers in context though, right? This is the largest spike in the pandemic's history here on Saipan. But of the 98 cases, 62 of them are believed to be in 1 or 2 congregate living facilities. It's unconfirmed, but we are hearing that it's possibly related to some construction workers in the congregate living area. We're also hearing that the remainder of those cases are linked to some known clusters as well. And so one of the things that they were emphasizing, and something that even the CEO of the NMI hospital, Esther Muña, tweeted this morning, is that the contact tracers are working and that they're finding these cases and are continuing to make more links to them. Unfortunately, we're also learning that there are some cases, one case at least that was found at Mount Carmel School and also at the Northern Marianas College. And similar to Guam, as our Isaiah was reporting yesterday as well, schools are expected to open on the same day here in the CNMI, November 29. Wow. And yesterday we had Representative Sheila Babata, who was the vice chair of the Education Committee, say that a lot of the education leaders who went to the legislature this week said they probably would have preferred all of the students to stay on campus where they can, quote unquote, control their behavior and where maybe contact tracing and mitigation efforts can be more monitored. We're hearing a lot of mixed things. Some people are saying, where are the restrictions? We want to see restrictions. This is the largest spike. And others who are saying we have the vaccine, the contact tracers are at work, and they're confident that this will be seen through. As we reported, about 85% of Saipan's population is vaccinated, and they started rolling out the kids' vaccines ages 5 to 11 just a few weeks ago. And one thing we did ask, everyone's wondering, right? Because while the quarantine protocols ease between everywhere else in Saipan, lots of folks are also concerned about what this might mean for Tinian and Rota, 2 places that have not experienced any sort of cases by any measure at the same rate as other places have, just here, in the Pacific with our neighbors. And so the task force chair, Warren Villagomez, was telling us that so far, there's no evidence to believe that the spread has reached Rota and Tinian. However, they're speaking with island leaders there, the mayors of Rota and Tinian, to talk about what mitigation efforts might look like. One thing they did emphasize is that the testing capability is available on Rota and Tinian, and the vaccines are available on Rota and Tinian. We're waiting to hear back on when boosters will be available on those islands. But Bree, definitely a surge of its first kind here in the CNMI.
And having said that, what is, I guess, the mood of the community over there? Are they freaking out, or are they kind of like, hey, we know what we need to do?
Yeah, I think some viewers reached out and are saying, when we had one positive a few months ago or just over a year ago in the course of this pandemic, there was a lot of pivoting, right? We had a curfew set, businesses were shut down and things of that nature. But one thing that the COVID-19 task force and the Commonwealth Healthcare Corporation always emphasizes that the difference between then and now is that then we didn't have the vaccine. Yep. Now we do. One thing that was really interesting, and as we'll continue to track and get more details on from the COVID-19 task force, is that they're moving, in addition to an aggressive contact tracing effort, and in addition to getting more testing done, they're going to do something that they're calling targeted vaccinations. They're going to bring vaccines into these communities and populations. Now, what does that mean? What populations, what communities? I think that's a question we'll have to ask, because it does seem that they're making a pivot to bring vaccinations towards some communities. And I think it's a fair question to ask, which communities and why. And also, I think just a few weeks ago when we were talking with the Commonwealth Healthcare Corporation CEO, Munya, she was explaining how she's focused not so much on the vaccination rate, but on the vaccination number. And so if you look at it, and can probably update the numbers tonight, but around then we were talking about maybe around 10,000 who remain unvaccinated. And so for a small community like this, Saipan has about 50,000 people or so, and she says that she wants to remain focused on those numbers and not necessarily the rates that might not really paint a full picture of what's happening on the ground here.
Mm-hmm. What about hospitalizations? Because that's always been what our leaders have been looking at as the critical number that we pay attention to.
Yes, and so far we've had one active hospitalization, and that continues to be the case. Again, the 98 cases, as we clarified with the regional epidemiologist Stephanie Kern-Elili, she was sharing that these cases were identified on the 22nd, and so any sort of treatment or things of that nature haven't been administered just yet. But one thing that was also emphasized yesterday is that we do have the monoclonal antibody treatment, and more treatments on the way. The alternate care site, as we've been reporting, also the Kanoa Resort is what they're calling getting warmed up just in case, and the health centers on Rodantinian are also being talked to by the task force. So again, I think when we talk about community reaction and things like that, I think one of the biggest things they emphasize again is that we didn't have the science and resources and treatment that we do have now several months ago when we were just learning about this novel coronavirus and how to deal with it in the first place. And I think the next biggest conversation and some of the things, if you go over to our YouTube page to watch the full press conference that happened yesterday, a lot of people were commenting, what does this mean for face-to-face learning? Sources are telling us that face-to-face learning is still set to resume on the 29th. Of course, we've had Acting Commissioner of Education, Eric McGoffney, on the show, and I'm probably going to send him a message today to ask if that's still the case. But I think the focus now is, amid this holiday season, administrative leave is approved for, this week as well, and people are expected to gather. And so we'll try to cover everything on those fronts. We're also hearing that more offices are going to continue to be tested here on the island and that they're providing PPEs to them. Unfortunately, we're also hearing that at least one case was identified at the Northern Mariana Islands judiciary as well.
Mm-hmm. And, I wanted to just touch on that MAB just to help promote a little bit more awareness. As you kind of touched on in previous stories, there's kind of like a difference with the MAB treatments here. Once you test positive, you have to meet certain criteria and then you get referred. But over there, I think we were talking a couple of weeks ago that once you test positive, you just go, right? You don't have to meet any certain requirements.
Yeah, last we checked, Esther Munoz was telling us they do follow the CDC guidelines, and
Mm-hmm.
they've administered such treatments already to some mild cases. I think a lot of also news being looked at the treatment pill that was
Right.
that is expected to also be ordered and released into different communities. And so I think one thing too that we learned was that at these isolation facilities as well, the cases might also receive some treatment, but that doesn't necessarily translate to, an active hospitalization, so to speak, at the hospital. So that was also something that we clarified at least last week's press conference.
All right. Thank you so much, Tomas.
Thank you so much. We'll
Okay.
continue to bring you the latest, and great to see you, regardless of the news, Tyler, Jason, Sabrina, and Mike. Really wishing everyone to stay safe. And if you're listening to the CNMI, you can follow us for the latest on testing, vaccinations, and more.
All right. Happy Thanksgiving, by the way, if I don't see you later.
Thank
but I
you.
probably
Happy
will.
Thanksgiving.
All right. We're going to take a break, but when we return, we're going to talk about the Guam emergency